Good morning. Thank you so much for joining us. We are on the territory of Treaty 7, and I acknowledge the Métis people who share a deep connection to this land. I'm Julia Hayter, the Alberta NDP MLA for Calgary-Edgemont and the Critic for Status of Women. I am joined today by Dr. Rupinder Toor, the Medical Director and founder of the IUD and Women's Clinic. Thank you for hosting us at your clinic, and we're going to hear from Dr. Toor shortly. It is Sexual and Reproductive Health Awareness Week, and like our physical health and our mental health, sexual and reproductive health is fundamental to everyone's overall good health and well-being. The World Health Organization explains that good sexual health requires positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having safe sexual experiences, free of coercion, discrimination, and violence. The WHO says good sexual health and well-being depends on individuals. Access to comprehensive, good quality information about sex and sexuality, knowledge about the risks that they may face and their vulnerabilities to adverse consequences of unprotected sexual activity, ability to access sexual health care, and living in an environment that affirms and promotes sexual health. All Albertans deserve a government that fully supports everyone's sexual health, mental health, and well-being. To that end, if the UCP are determined to take sexual and reproductive health seriously, Daniel Smith will commit to expanding access to sexual and reproductive health today. Cervical cancer is the fourth most common cancer in women worldwide, with more than 340,000 deaths globally a year, and almost 100% of the cases in Canada are attributed to HPV. When diagnosed, cervical cancer is one of the most successfully treatable. On January 9th, the BC government announced that they would be the first province to expand access to the self-screening program for cervical cancer, including the options to take tests at home. We know the Alberta government began a pilot project on this self-screening program in October, and we are urging them to delay no longer and immediately implement this potentially life-saving program. We are calling on the provincial government to follow BC's lead and immediately implement HPV self-testing for those who request it. Having the option of HPV self-testing will help to address the healthcare crisis here in Alberta, and will increase access to cervical cancer screening for those individuals who may not feel comfortable visiting a doctor, including those who regularly avoid pelvic checkups due to religious or cultural beliefs or are going through a transition. We know that hundreds and thousands of Albertans do not have access to a family doctor, and these self-screening tests will give individuals the opportunity to detect HPV early and prevent cervical cancer. We are calling on the UCP government to support our previous calls for universal access to free prescription contraception across the province. Universal access to free contraception in Alberta will ensure that we have more women are in control of their own lives and their own economical future. Offering universal access to free prescription contraception is a good health policy, it's a good economic policy, and it's absolutely the right thing to do. I would now like to invite Dr. Toor to the microphone.
Thank you. Thank you and welcome to our clinic. I'd like to thank Julia Hayter and the Alberta NDP for allowing me this platform for this important message. I stand before you today as a medical doctor representing the almost 100,000 individuals and families that we have had the privilege to serve at this clinic. It is through listening to their stories that I have come to better understand the struggles of everyday Albertans. So on behalf of these patients in advance of the Alberta budget, I am asking the Government of Alberta to endorse a policy for universal access to free prescription contraception. This policy would improve the health of children and mothers, strengthen Alberta families, make life more affordable for everyday Albertans, and it saves public dollars. Birth control was decriminalized in Canada in 1969. The most popular form of birth control are not the most effective, but they are the cheapest. Highly effective, long-acting contraceptives can cost up to $500 upfront. Statistics are the stories with the tears removed, and currently 40% of pregnancies in Alberta are unintended, resulting in an estimated $40 million in direct healthcare costs alone. This does not factor in social subsidies or larger downstream social costs. The cost of universal access to free prescription contraception in Alberta is estimated to cost less at $35 million in the first year. We would expect cost neutrality by year 2, a $4.5 million savings by year 3, and a $24 million savings in year 4 onwards. Studies have shown every dollar invested in universal access to contraception can result in $4 to $7 saved in direct healthcare costs and up to 9 times of savings in the public sector. Simply put, the cost of providing free contraceptives is considerably lower than the costs associated with unintended pregnancies. And while there is a cost to providing free contraceptive, the real question is, what is the cost to society for not doing this? Birth control is not free in Alberta. Cost is a barrier to the most vulnerable in society. And while some programs exist, they can be patchy and difficult to access. Complicated application forms, very low income thresholds, incomplete coverage, high deductibles, and further, a federal petition filed by our group in August of 2023 received almost 13,000 signatures, with almost 30% coming from Alberta. It was the most signatures at the time of all open petitions and ranks in the top 2% of all petitions in the current Parliament. This policy is also endorsed by major national medical stakeholders like the Canadian Medical Association, the Society of Obstetricians and Gynecologists of Canada, and the Canadian Pediatric Society, and many more. So the public and experts overwhelmingly agree that this is an irresistible policy. With clear benefits, this policy has enjoyed great support and success worldwide in places like the UK, Australia, and New Zealand. In Canada, this policy is gaining momentum and has already been endorsed by the governments of British Columbia and Manitoba. Now, will the government of Alberta lead in recognizing and investing in our most important resource, our people? And the real question may not be, why would the government endorse a policy with such clear health and social and economic benefits, but rather, why would they not? And on Sexual and Reproductive Health Week, this is an excellent question for all who deserves a good life. Thank you.
Thank you, Dr. Toor, for being such happy to take your questions.
All right, thank you, Julia, and thank you, Dr. Toor. We'll now go to questions. Just a reminder for those joining us on Zoom to use the raise hand function, and for those joining us on the phones to use the star. With no questions on the line, we'll wrap today. Thanks, folks.